Hello and welcome to PhDtalk. My name is Miriam and I'm the host of this podcast where I interview PhD students and experts in fields relevant for PhDs, like today. For today's episode, I interviewed Zoya Ashabi. Zoya is a dentist by training and then switched to a career as a medical writer. Medical writing could be one possible career path for you if you enjoy writing, if you are excited about the medical field, and if you wish to have some freedom when it comes to your work. Also, because medical writing can be done as a freelancer. So in this episode, Zoya shares with us, what is medical writing? What does a medical writer do? She shares some tips on how you can get to become a medical writer, what skills are needed, how you can get them, improve them. And she shares some of her excitement with us, the reasons for why she enjoys being a medical writer so much. So I hope you get something out of this episode, and then let's talk science. Hi, Zoya.
Hi.
Nice to have you here.
Thank you very much for inviting me.
Sure. It's really nice to meet you. But today we're going to talk about medical writing and probably other things. Would you like to introduce yourself a little bit?
My name is Zoya. I'm educated as a dentist, but the last year I was a student. I did a project with one of my professors in university. And at that time, I really didn't know that medical writing exists. I had no idea about that. He wanted me to write something, and then he introduced me to other medical writers, and it was the first time I understood that some people are doing that. It was very nice, I think. And then I was not that much into it. After the project was finished, I was done with that also. So I went back to the clinical job. But two things happened for me. First, I immigrated. I was educated in Armenia. I went back to my country. Again, I immigrated to Denmark in 2014. I continued taking exams for being again the dentist here and working. Also, I was working part-time in clinic. And then some other projects in medical writing, I saw them here. And as there are many biotech companies, pharma companies, the famous one, Novo Nordisk, are here. And Denmark is actually a very good country for such kind of things. So I saw many job announcement for medical writing. And then I think that, I thought I will transfer to this field. I was doing it part-time and do the clinical job. But since 2017 to now, I'm mostly focused on medical writing.
Okay. Yeah. So it was a bit of an accidental discovery.
Yes.
Those are always good ones.
Yeah.
Okay.
Actually, I saw, for example, some medical journals in university, but I never thought who is gonna write them. What are they doing? I was just a reader like other students.
Mm.
Yeah.
Okay. Yeah. And could you tell us a bit what is medical writing and how is it different from other scientific writing fields?
Medical writing is the kind of writing, the medical field and medical terminology, which are very vast and also needs expert language. Mm-hmm. You should write it in a simple way that reader can understand it easily, even that person is expert in this case or not. Always expert medical writers say that if you can explain it to a 5-year-old, so you have done it well.
Okay.
Yeah. And it is actually like other kind of medical field. It has many different branches, like regulatory writing or medical journalism, or those who are writing CMEs, continuing medical educations, manuscript, such kind of things. The difference between medical writing and scientific writing is that scientific writing usually it is written by researchers or scientists themselves. And medical writing, not just doctors or nurses who are writing this. If you have, for example, bachelor in English literature and you have the good understanding of medical field, you can write it also. And it's very focused on medical and health subjects. But in scientific writing, you maybe write about physics, chemistry, Biology, I don't know everything. Also, the rules are not that much tough in scientific writing, but in medical writing, when you're writing something, you should be very careful what you are writing, especially if the documents are going to authorities, like the things we write in regulatory writing. You should be very careful about that. Also, in scientific writing is mostly about the discoveries and research and on scientific fields. But medical writing are just about healthcare, patients, and drugs, clinical trials, something like that.
So medical writing requires that one, of course, understands all the medical terminology, right? I guess that includes drugs and body parts and maybe diseases or something like that.
Yeah.
And then those are translated into a way or into a language that can be understood by people who are not doctors and not nurses and not
It is a field, and sometimes sometimes you are writing something just for the doctor in that field. For example, maybe a new surgery. Heart surgery can be a new way of something to do that. So you're writing it for just cardiosurgeons, not necessarily for patients or nurses.
And who are then typically, like, where do you get the topic from, basically? And who are you writing to?
Those who are giving you the job, the project, they always mention that they're writing the audience, who the audience is.
And those are companies, but could it also be hospitals?
Yes.
Or pharmaceutical industry?
Yeah. And then, for example, I wrote for an app. It was an internal app for hospital. It was just for doctors and nurses in the hospital, for introducing a drug and how they can use it for the patients and something like that. It shouldn't be that much in a simple language because they already know the terminology. If I used, for example, the name of a disease or something, I don't have to explain for them. They know it already.
So part of the job is explaining procedures, like medical procedures, like you said, the new way of heart surgery or a way of applying drugs, right, to patients?
Yes.
And what are other examples?
In regulatory writing, we are not writing it that much simple because those documents are not going to the patients. Mostly it is for authorities in the process of the drug or some medical devices, which it can be the technical medical writing for the medical devices. You know that when they invent it, you cannot just use it. It's a long process to get the drug or device for the ordinary patient to use that. For example, a drug, if they somehow make a medicine, so it's around 20 years to come to the pharmacies. And for this different process, you have different documents that be write and then send to authorities to get the acceptance, the license for that drug.
Okay, so those are then applications for new machines, new tools, new drugs, or anything that is related to. Okay, and those are then sent to authorities for approval. So that is another example of what a medical writer can do. And if, like, for example, a PhD after their training, if they would like to become a medical writer, what would you advise them to do?
First of all, they should think about the skills for medical writing. I know that in PhD and research, you get many skills, you can use them in medical writing. But if you really want to shift to this field, you have to learn it. And the best way is to have the mentor for that. I really suggest people who want to do this, first read a lot and then find some writing course. It's better to write something for a course or somebody who can correct you, not just writing for yourself, because it's very different. Sometimes we ourselves think that we have written a very great thing, but it's not. And find which type of medical writer you want to be. First of all, otherwise you're wasting a lot of time. And then grammar, spelling, they are very important. And I have seen many medical writers who do not think they need editors, but they need. That's also a very important thing, I think so. And learning communication skills. Also the knowledge about this field. I know that some medical writers, some PhD students are not that much familiar with the specific field. It is better to read a lot for getting those knowledge. Critical thinking also is very important in that case. How to analyze the data, the things you are getting. You cannot always trust any source you receive. I mean, you should categorize them and then check if they are very trustworthy or not.
So is it that you typically get the data from a clinic or from a company, or would they also ask you to do the research and then write a summary, basically, like a review for them?
It depends on projects. Sometimes they themselves, if it's something internal, they provide it themselves. But sometimes I have to check it, and sometimes I have to pay in to get the research, because you know that not all the research are for free.
Of course.
Yeah.
Could you walk us through maybe the process of how you do it? Like, do you have a routine of how to approach a project?
Usually between in the morning or in the afternoon, I block time and I just write. And I suggest anybody who wants to do that, block the time and take it seriously. Because if you're a freelancer and you're doing it at home, or even if you are not freelancer, you are in the office, anybody thinks that they can interrupt you and you cannot gather your thoughts. Make a routine for yourself. It should be like, I will do it, for example, every day between 9 to 11. And then I will have a break doing, for example, answering emails or talking with recruiters. Sometimes they interrupt me a lot. And you should put a limit for that one. I know that they are doing their job also, but you should give them a limitation. Otherwise, you find yourself just every day answering many emails and talking to people, but not doing the job itself. That's important, especially when you have the deadline. And deadline is a very important thing in medical writing, especially if you have different projects at the same time. So they have different deadlines. Sometimes you are very close to each other. So you have to manage your time. You should learn time management very well.
Okay. Yeah. Thank you. I think those are tips that can also be applied to, to other writing or other work, right? Yeah. Could you give us some examples of projects that you had or of pieces that you wrote so that one gets a bit more of an idea?
As I told you, for example, I wrote for an app and video manuscript, which was using for doctors, teaching them in some courses. Also, I've written for pharma companies introducing their drugs. I also have written some about the catheters and they were using in women after they childbirth, some medical devices in this case.
So would it also, for the first one, when it's about education, would it also be writing like study books for medical students?
Yes, it is also one of the part. Yeah.
And then you don't only do medical writing itself, but you also do mentoring for people who want to become medical writers, right?
Yes.
And how does the collaboration with you then look like? How do you guide them?
Usually they find me on LinkedIn, and then if they want to ask some question, if it is if there are some short questions, I will answer it as soon as possible. I write to them, but they can book time. And then first half an hour is usually free. I do that, but they can book every time they want and I will guide them.
And then they would send like a text sample to you, or you give them assignments, or how?
Yes, sometimes they send the text to me and I don't rewrite it for them, but I always say whatever they can do to improve themselves.
Okay, yeah. I think that's also an interesting career path for potentially PhDs if they don't know what to do.
Yes.
After having graduated, then medical writing could be something for someone who likes to write and research and...
Yes, because I think not all PhD students are interested in going to industry or some work like that. Like any job, it has its advantages and disadvantages. But those who wants to have a little bit more freedom, for example, they can have it.
So medical writing is typically a freelance job?
No. You can be employed. So,
Okay.
yeah.
Mm-hmm. Do you have something else that you would like to share on medical writing?
I can mention some mistakes some people may.
Yeah, please. Yeah, please.
I've seen the most important one is knowing your audience. I've seen some people make a mistake. Writing for patients or ordinary people is very different to writing for doctors, for example. So knowing audience is very important. And you should know your what and whys. What am I going to say? And why am I going to say that? Why am I writing that?
Mm-hmm.
I read somewhere, okay, the last question after you decide is that, so what? Is anybody going to read that or understanding or get something out of that or not?
Okay. So would you ask yourself that question after every paragraph or after every sentence?
No, before starting.
Before
starting, you should know that what are you doing. Otherwise, it's somehow better to cancel it, not to do that really.
Okay. Mm-hmm.
Yeah. And avoid jargons and do not use words that you do not use in your speech. I mean, sometimes people try to find something that they usually don't use. Do not do that.
So that is like, I don't know, if I'm looking for like synonyms and I find a word that sounds fancy.
Yeah.
That's what you mean?
No, it's better not to do that.
Okay. Yeah. Okay. So only words that one is familiar with.
Yes. Yeah. It's better to write it in your own language. Okay. It's very better. And then use editor if you think that many of us, we think that we are good, but we are not that good. And if you give the piece you have written to an editor, you'll be shocked. It's better to use the editor.
Yeah, I mean, I also appreciated that from writing scientific manuscripts. We always send them, when I was a PhD, we always sent them to editing. Mm-hmm. And I really appreciate the comments and the rewriting. So, yeah.
And find the professional support, I think. It's very important. I have seen people do not do that, and I think it's a very big mistake.
I guess it's also quite a responsibility to be a medical writer, depending on what one writes, right?
Yes. Yes. I know that we don't own the thing we've written. We are not like writers. For example, if you buy a book, the writer's name is there. Our name usually is not there. We just write them.
Right. I mean, there is no legal obligation to.
There are some obligations because it should be checked that it is correct, but we don't own them. I mean, there's no name of me.
No. Yeah. No. Of course. Mm.
Yeah.
Okay. Yeah. Thank you. I think that there are some good tips also for other disciplines. Actually, I mean, considering why and what is always a good question. I think for many aspects in life. What is it that you enjoy in medical writing? What keeps you being enthusiastic about it?
I can learn about different fields of medicine because as a dentist, I was just working in the mouth, an oral cavity. And it was very boring, I think. I think learning part is very important and very interesting for me. I keep my mind fresh always. Mm-hmm. Yeah.
Is there something that you would like to work on in the future, like some medical field that you would be like...
Mostly I want to be most in oncology and surgery. I mean.
Okay.
Yeah. Mm-hmm. I think if I was doctor, I will get a specialty in those fields. So I like to do that in medical writing.
In your next life.
Maybe.
Maybe. Okay. Yeah. Thank you very much for sharing.
Thank you for inviting me. It was very nice being with you. And
yeah. And I will share your contact details. So if people are interested in medical writing.
Yes, they can find me on LinkedIn, on Twitter, on YouTube also. Trying to teach medical writers whatever I know.
Okay. Yeah. Thank you very much.
Thanks.
Welcome back. Thank you for listening today. I hope you got inspired by Zoya and that medical writing is maybe something that you would consider as a possible career after your PhD. If you have questions or comments, then please share them with us below the post of this episode on LinkedIn. If you would like to know more about medical writing or get in touch with Zoya, then check out her LinkedIn profile or her other social media channels, which I share in the blog post of this episode. If there is a topic that you would like to know more about, then please let me know. I'm always open to suggestions. I'm always looking for people to talk to, be it PhDs or experts in fields that interest you. And then thank you so much. And I'm looking forward to welcoming you here again next time. Until then, I wish you all the best and a wonderful summer. Bye bye, yours Miriam.